Okay. So it's funny because I didn't build in 20 seconds for the introductory slide. So anyway, my name is Kenny Fader. I'm a PhD student at Johns Hopkins University. Elizabeth Letourneau is my advisor over there. And today I'm going to talk a little bit about children and families and their experience in the United States opioid epidemic. So opioids, they're the class of drugs that acts on the brain's opioid receptors to produce morphine-like effects. They include pain relievers, illicit drugs like heroin, powerful synthetics like fentanyl, and last year they killed more Americans than motor vehicle crashes or firearms. So most of what you've probably heard about this opioid epidemic is focused on adults. But what I'd like to talk about today is how this epidemic might be impacting children. And we'll talk about some direct and indirect ways that might be happening, why it is the families that are struggling with the opioid epidemic might not be getting the treatment that they need, and then we'll do a quick review of some promising best practices for meeting the needs of these families. So what's going on? Well, first, over the course of the last several decades, like adult overdose, adolescent and young adult drug overdoses have doubled and quadrupled, respectively. There have been also increases in opioid use during pregnancy. And this is associated with a number of adverse birth outcomes. Although it's important to note that this could be due to the trauma that commonly co-occurs with opioid misuse during pregnancy, rather than the effects of the drug on the fetus itself. Third, I should note that while infants receive the most attention, there's ways that a parent's opioid misuse might impair their ability to adequately bond with, supervise, or care for children of all ages. And in fact, there's research that links rising rates of problem opioid use in a community to increases in intentional and unintentional injuries in that community. And finally, a parent's opioid misuse can lead to an extended period of separation from a child. This could happen because of a parent's incarceration, because of a parent's stay in residential treatment, or because of a child's placement in foster care. But it's important to note that this isn't a direct effect of the drug use. This is a consequence of how we as a society choose to respond to the parent's drug use. So let's focus on foster care, because there's research showing right now that the number of children in the United States foster care system is increasing because of the opioid epidemic. And we don't generally take children away from their parents because of other treatable illnesses, so it's worth talking about why addiction is treated differently. I'd like to propose three possible reasons. So first, child welfare systems are often ill-equipped to meet the needs of families struggling with addiction. In particular, there's a lot of misinformation. So the best treatments for opioid use disorder almost always involve treatment with medications like Suboxone that prevent the symptoms of opioid withdrawal. But misinformation about these treatments, research shows, abound in the child welfare system. And in fact, in some states, parents can be charged with child abuse for taking these medications. Second, substance use treatment programs are often ill-equipped to meet the needs of families. They don't offer child care, they don't have domestic violence services, and many states don't have a single specialty treatment program for pregnant women. Finally, we can't talk about family addiction without talking about stigma. In the United States, it's a common cultural norm to treat family addiction as a moral failing. But this runs counter to our understanding of the biological basis of the disease and underpins the misinformation that exists in both systems. My research is some of the first to take a look at family opioid use on a national scale. I took data from surveys conducted across the country between 2010 and 2014 and identified a population of adults who met criteria with opioid use disorder. I compared adults who live with a child to adults who don't live with the child on their substance use treatment and the barriers they face to care. Now, it turns out there are more than 800,000 American adults with an opioid use disorder who live with at least one child. But fewer than 30% of this population reports receiving any substance use treatment in the past year. My research shown here shows these adults living with a child face different barriers to care than their counterparts who don't live with a child. They're more likely to say that they can't find a slot in the kinds of programs that they think they want to attend. They're also more likely to say they won't get treatment because a parent, because a friend or a neighbor might find out. Remember stigma? So in my final few minutes, I'm going to talk about potential solutions. So first, Medicaid. So research shows that social workers consistently report that when parents have Medicaid, they get into substance use treatment faster and they stay in treatment longer. Some states are considering furthering expanding Medicaid to more adults. Others are considering imposing new restrictions. further expansion is almost certainly in the interest of families involved with child welfare. Second, federal foster care reform. Beginning in 2019, for the first time, states are going to be able to receive 50% reimbursement or more for providing substance abuse treatment services to families at risk of having a child enter the child welfare system because of addiction. And states should take advantage of this opportunity as soon as they can to combat the opioid epidemic. Third, family drug courts are a promising approach. These drug courts, which help divert families into substance use treatment and towards case management, have been shown to expedite time to reunification and increase the amount of time spent engaged in drug treatment. Fourth, the Children's Bureau has issued more than 20 regional partnership grants, which facilitate collaboration between child welfare agencies, substance use providers, and other providers on the ground. And these pilot grant programs are going to provide valuable information about how to improve collaboration between these parties across the country. Finally, there are effective drug control policies like pill mill crackdowns or prescription drug monitoring programs, which I can talk more about. And these policies have been shown to reduce problem prescribing and overdose deaths. So an active area of my research is whether they'll help prevent child welfare involvement as well. But stay tuned, because that's my dissertation. So finally, it's incumbent on all of us, professionals, researchers, and the media, to be advocates for these families. And so when we describe the unique challenges that these families face, and when we describe what can be done for these families, and emphasize that families struggling with addiction can and do recover, we lay the groundwork in support of programs that helps these families heal. Thank you.